First you zoom the image. अब राइट साइड देखेंगे. So this is a patient of retinal detachment, operated 20 years back. राइट साइड देखिए पूरा. So what you see inferiorly is the buccal indentation. So you can see the buccal indentation here, which is inferior to the right side to the image. Right side देखिए और. So you see this is the buccal indentation. The retina is raised up. This is a good buccal height. Right side ऊपर की तरफ देखिए. And you see here the edge of the band, the 2-7 band. So it ends here. So you can see the edge right in the center. Right, so these are long term this thing sequelae, that there is RP proliferation here. You can see that inferiorly, that RP proliferation inferotemporally. सीधा देखिए. So this is the RP proliferation. नीचे की तरफ देखिए. So these are the cryo marks in the lattice areas. ऊपर की तरफ देखिए. नीचे देखिए. And the left eye, at that time the laser was not that popular, so ma'am doesn't remember, but I feel that there has been cryo done to the lattices inferiorly. Here थोड़ा सा लेफ्ट साइड देखिए नीचे. And at this region, so the cryo usually has white scarring and the black pigmentation. So you can see the lattice on the right side with the holes and the cryo marks very well, perfectly covering the lattice areas. ऊपर देखिए straight. And so you can see the myopic disc. सीधा देखिए. सीधा एकदम ऊपर ऊपर. So this is recorded by the Keeler mobile indirect ophthalmoscope. So you can see the images so well and clear, crisp. सीधा देखिए. लाइट में देखिए, लाइट में देखिए. So we're just checking for the posterior pole also. There's myopic crescent. There are no lacquer cracks or anything like that. So retina is perfectly fine. This eye vision is 6/6. इधर देखिए straight. And this is the eye which was buckled. इसमें लाइट में देखिए. And this eye vision is 6/18, the right eye. That is approximately 20 by 60 in this eye, and the other eye was 20/20.